strengthen the export quality regulation and management. We have with us Director General Li Xinqian from the Department of Foreign Trade from Ministry of Commerce, Director General Jing Hai from the Department of General Businesses of GAC, Inspector Li Yujia from the Bureau of Law Enforcement and Supervision from SAMR, and DDG Wang Shucai from the Medical Device Regulation Department of NMPA. So they will take questions concerning the export of medical supplies and the emergency approval for the medical devices and the supplies. Let me first give you the update of the pandemic. Yesterday, between 0 and 24 o'clock, China's mainland reported that for newly increased confirmed cases, the number is 11, including 5 overseas imported cases, respectively 3 in Shanxi, 1 in Inner Mongolia, and 1 in Shanghai. 6 are indigenous cases, respectively 5 in Heilongjiang and 1 in Guangdong. There's no new fatal case and nor new suspected case. Yesterday, 48 cases were cured and discharged from hospitals. Close contacts removed from medical observation numbers 779, and the number of severe cases increased by 2. For overseas importation, the remaining confirmed cases number 694, including 22 severe cases. Now there are 10 suspected cases. In total, the number of confirmed cases reached 1,634, and 940 cases are cured and discharged from hospitals. There's no fatal case. By the end of yesterday, China's mainland reported that for remaining confirmed cases, the number is 801, including 51 severe cases. In total, the number of cases cured and discharged from hospitals is 77,394. The total death tally is 4,632, and the total reported confirmed cases is 82,827. For remaining suspected cases, the number is 12. Close contacts traced in total is 729,885, and the close contacts still under medical observation numbers 8,308. For Hubei, yesterday there was no new confirmed case, nor suspected case, nor remaining suspected case, nor death case. 11 cases were cured and discharged from hospitals, and there are 12 remaining confirmed cases all in Wuhan, and there's no severe case. In total, the number of cases cured and discharged from hospitals is 63,604, including 46,452 in Wuhan. The total death tally reaches 4,512, including 3,869 in Wuhan. In total, the number of confirmed cases is 68,128, including 50,333 in Wuhan. China's mainland reported that for newly increased asymptomatic infection, there are 30 cases, including 7 overseas imported. Yesterday, 4 cases were transferred to confirmed cases, and 9 cases were removed from medical observation, including 6 overseas imported. For asymptomatic infections still under medical observation, the number is 1,000, including 151 overseas imported. In total, from Hong Kong, Macau, and Taiwan, the number of confirmed cases is 1,511, including from Hong Kong SAR 1,037, 45 from Macau SAR, and 429 from the Taiwan region. Yesterday, April the 25th, for overseas imported and confirmed cases, 60% of them have already been cured and discharged from hospitals. The number of severe cases compared with the previous week dropped by 53.2%. The global daily increase exceeds 90,000, so the overseas spread of the pandemic is increasing, and the risk of overseas importation is worsening, and we still have the indigenous related cases with these overseas importation. So we need to identify the cases as soon as possible. The latest information says that with the strenuous efforts by Wuhan and the medical teams to Wuhan, on April the 26th, there's no inpatient for COVID-19 in Wuhan. For the next step, we will continue to follow the instruction from the central government and prevent any potential resurgence domestically or the overseas importation, and also to satisfy the needs of the general public. That's all for the update. Now we will take the Q&A. Please focus on today's topic and put forward your questions. Please first identify yourself. The floor is open. First question, on the left, the front row, the first gentleman, please. Thank you, DG Mi. Since March the 31st, the GACC, the Ministry of Commerce, have jointly issued the relevant policy documents, and then in April, another policy document was issued by the 4 related government agencies concerning the export quality of the medical supplies. What are the considerations behind such frequent policy documents? We will have DG Li Xingqian to take the question. Thank you for your question. Indeed, faced with the global pandemic, China is working with the countries in the world and international organizations like WHO to have a pandemic response. Medical supplies are of vital importance to people's health, to China's national reputation, and the global response capacity. As the global spread is continuing, countries have increased needs for medical supplies. The Chinese government is making every effort to satisfy the domestic needs. In addition to that, the government is offering as much as help as possible to other countries while expanding the medical supplies export. We try to ensure the quality of such export supplies in order to better contribute to the global pandemic response. On March the 31st, the related government agencies worked out the policy document number 5, which was designed specifically for the export quality. The policy has achieved a lot in terms of the quality of the exported supplies. Now we can see there's a large volume of products, in particular medical supplies, exported. However, due to the various differences in terms of the use and the other aspects, we do find some problems, as well as the confusion concerning the purposes of these supplies. That's why yesterday the GACC and the SAMR jointly issued the number 12 public policy notice requesting the exporting as well as the importing parties to sign a joint declaration confirming the relevant quality standards applied and the respective responsibilities. These 2 policy notices are designed for different subjects or targets.
but they have consistent purposes and they are in force concurrently. Number 12 decree is a further improvement to number 5 decree. It is our hope that with the array of targeted measures, we can further improve the quality of pandemic prevention control supplies for export, prevent against quality-related risks, to show the sense of responsibility of China and safeguard the credibility of Made in China. Jointly, we will respond to the public health crisis of the Thank you. Next question, please. Journalist from the first row on the right side, please. Thank you. With the National Business Daily, the outbreak of COVID-19 in other countries have increased the needs of masks, but because of the different standards adopted by different countries, the non-medical masks exported from China are sometimes used as medical masks. Therefore, there was a new policy requiring the exporter and importer joint declaration explaining that exported products from China accept the non-medical mask for medical uses. I'd like to ask DG to take the question. Thank you for your question and thank you for your concern on the issue. The number 12 decree jointly issued by 3 ministries and departments aim at improving the monitoring over manufacturing and exports. When enterprises and manufacturers are to go through the export clearance procedures, as DG Li has mentioned, the exporter will issue electronic or electronic joint declaration or in paper. The joint declaration is by the exporter and exporter. Other export clearance procedures remain unchanged. For the declaration in which the product is up to the importer country's standard, then the Administration of Customs will then release the products for exports. And for those that are not included in the list of SAMR, GACC will accept the application, check it, and release it if they are up to the clearance procedures. We've also put forward these requirements for the enterprises to refer to, and the clearance of the exporters will not be influenced if they are up to the standards. We'd also like to remind the manufacturers in the column of the manufacturer, enterprises are recommended to fill in truthfully the name of the manufacturer rather than the exporter, and also they should fill in the purposes for use, non-medical or medical use, the product specifications, and also please remember to file in the joint declaration by exporter and importer. Next question, please, journalist from the second row on the right side, please. Thank you. With the CCTV. The leadership group, in response to the pandemic, requires that the substandard producers will be held accountable and be brought to justice, and also those who have been profiteering from a hyped price will also be brought to justice. What are the measures adopted by SAMR? Thank you for your question. Inspector Li Jiayu from SAMR is taking the question. From the start of the outbreak, SAMR has made our analysis on the market orders influenced by the pandemic. With the unfolding of COVID-19, prices might fluctuate. In particular, pandemic prevention control supplies might be subject to fluctuated prices. In particular, there might be some illegal practices and behaviors. Therefore, from the beginning of the outbreak of COVID-19, SAMR deployed national law enforcement activities to control the stability in prices. Up till now, the market supervision authorities across the country has been following the guidance from SAMR, the price gouging, the deceit in price, and other illegal practices have been brought to justice. We have also set up some thematic programs to look into most severe cases. During the response, the price-related ill practices were altogether more than 10,000 cases, and we've punished 12,000 illegal practices. Journalist from the second row on the left side, please. Thank you. With CGTN, there has been an increasing need across the globe for pandemic response medical devices. My question goes to CFDA. What has been the monitoring measures adopted by CFDA to enhance the monitoring over the medical devices for export? I'd like to ask DDG Wang Shucai from CFDA to take question. Thank you for your question. This indeed constitutes an important task of us. Since the outbreak of COVID-19, CFDA has adopted an array of measures to enhance the pandemic response medical devices quality. We have been focusing on the quality monitoring on top of ensuring the needs of domestic pandemic prevention control. We've also been focusing on contributing to the global efforts in response to COVID-19. On 27th of March, 3rd, 9th, 17th, and 23rd of April, we have carried out several dedicated programs to monitor the quality. We've carried out the following measures. First, we've set up a list of export manufacturers and focus on the monitoring over key exporters. We require the local FDAs to set up their provincial list of exporting manufacturers and made dynamic adjustment. We've set up the documents and the files of the exported medical devices to ensure the export can be traced back to its origin. This list of exporters must be monitored by the local government, and a local accountability system is in place. Second, we've continued to standardize the export certificate system. All those that are to export medical devices must have certificates of their qualification. We have very strict measures in place to ensure that all those that are exporting medical devices have the certificates. Provincial authorities should also follow the same standard for those manufacturers who haven't got such certificates of qualities are forbidden to export medical devices for pandemic response. Third, we've decided on the key items of our monitoring and inspection and stepped up inspection. Provincial authorities has worked out a list of checks, and the accountability is on individual officials. They will focus on the inspection of key problems and key links. Once there is evidence showing some substandard products by enterprises, then problems must be clarified. Without clarification of the problems, without correction efforts in place, the enterprises are forbidden to reproduce. Fourth, we require FDAs at all local levels in accordance with the quality for export needs, they need to adjust the items of checks and inspection and focus on the random check on 5 categories of medical devices.
Such checks cover all the products produced in this province, in particular the newly approved productions in the particular province or the companies. Fifthly, conduct the joint inspection and check and emphasize the accountability system together with the relevant government agencies from SAMR and etc. We have conducted the joint inspections in the 5 key exporting provinces. We went to the fields to inspect the companies and share the inspection results with the relevant government agencies, and we held the local governments accountable for the practices. By April the 24th, the local drug authorities conducted various on-site inspections, and the total number of companies checked reached over 1,600, and such on-site visits and inspections conducted exceeded more than 6,300 times. So the NMPA is making every effort to ensure the quality of the exported products. Okay, thank you. Let's continue. On the left, on the 3rd row, the first reporter, please. Thank you. With Hong Kong Economic Herald, it is said in some media that the Chinese face mask producers are pressing down the price in order to win from the competition. Is it true? If yes, what are the countermeasures to solve such problem? We will have DG Li Xingqian to take the question. Thank you for your question. Thank you for helping us to summarize very different media coverage and also very different media conclusion. This also indicates that some of the media coverage are not accurate and not fact-based. As the pandemic is spreading rapidly throughout the world, China is satisfying the domestic needs in pandemic control. At the same time, we are making every effort to support the countries for their procurement of medical supplies and other anti-epidemic supplies in China. As you know, the price is determined by the market and by the supply and demand. In short time, we may find the price fluctuations because of the supply and demand dynamism, and also maybe because of the abnormal price fluctuation. However, in general, it is fair to say that the products, especially the face masks exported from China, are of standard quality and are of a very reasonable price. We should not undermine the interests of the Chinese face mask producers, and of course, we should not have those illegal behaviors and practices undermine the image of made in China products. That's why the Chinese government has adopted a series of measures to cover the production, the trading, the certification, accreditation, and exporting. We wish to strengthen the quality management throughout the supply chain. The relevant agencies are working together to crack down the illegal practices, such as bidding up the price or hoarding the supplies or products. Any abnormalities or malpractices identified would be investigated, and the confirmed illegal practices would be severely punished. Okay, let's continue. On the right, on the fourth row, the first reporter, please. Thank you. With the Hong Kong-China review, it is said that on April the 23rd, WTO mentioned that there are 86 countries in the world which have already banned the export of medical supplies. We also noticed that the Chinese government quickly come up with the number 12 policy circular right after the number 5. Does that mean China will also ban the export of such supplies? We will continue to have DG Li to take the question. Thank you. Mankind is sharing the same future, so we have the one world and the one fight. The fight against COVID-19 makes us fighting on the same battlefield. As the pandemic is worsening in the world, China relates itself to the difficulties and hardship going through by the related countries. Now, even though in China, throughout the country, we have the work resumption, the production resumption accelerated, the domestic pandemic response is still an arduous task. However, the Chinese government has made every effort and adopted every possible means and form to provide support and assistance to the international community to its best capability. China has never restricted the export of the pandemic response supplies. Instead, we have made every effort to facilitate and support the international procurement of such supplies in China. First of all, the commercial procurement of the anti-epidemic supplies in China is unblocked. According to the data we have, 74 countries and 6 international organizations have already signed contracts with more than 190 batches of products, medical supplies and anti-epidemic supplies with a total value of more than billions of US dollars. At the same time, we have already been engaged in about 200 contract negotiation concerning the procurement. With the marketized approach, China has already exported to more than 190 countries and regions in the world such anti-epidemic supplies. Together with the relevant government agencies, the Ministry of Commerce has provided facilitation in various aspects of the supply export. Furthermore, the data from GACC also shows that the medical supply export is being expanded steadily. On April the 23rd, China exported 1.06 billion face masks. And this has meant a 3.7 times increase compared with the face masks exported when we issued the number 5 policy circular. And thirdly, countries in the world have highly appreciated the China's facilitation and assistance. Many countries have already sent notes of appreciation. The anti-epidemic supplies produced in China are sent to the urgently needed countries at the earliest possible time. We sincerely hope that people in the world can overcome the difficulties. The so-called China's ban on export is totally groundless, and it's a misunderstanding. People's life is the priority, and the quality of the supplies would allow no defect. The Chinese government and the people will pay great attention to the quality of the exported supplies. That's why we have the two policy circulars, which are designed to ensure the quality of the products for medical use and non-medical use, respectively.
The policies are designed to be responsible for the health of peoples. We want to ensure qualified Chinese products can be more effectively and efficiently provided to the international market so that the end users can feel assured of good quality products. We are making concrete contributions to the global fight against COVID-19. Thank you. Next question, please. Journalist from the fifth row on the left side, please. Thank you. With the Phoenix TV, we've noticed that after the outbreak of COVID-19, CFDA has started emergency vetting process on the prevention-related supplies. How many products have been reviewed and approved, and what has been the quality of these products and devices? DDG Wang Shucai is taking the question. Thank you for your question. Medical devices have played an important role in the diagnosis, treatment of the patients, and prevention and control of the COVID-19. Since the outbreak of COVID-19, CFDA has been following the national guidelines and have been including the urgently needed medical devices into our emergency vetting procedures. We've initiated the emergency vetting processes to serve the COVID-19 prevention control efforts. We have done the following jobs. First, CFDA scientifically and efficiently carried out emergency vetting processes. Take the NAT tests, diagnostics, for example, we intervened early and we followed the scientific and emergency response principles of the vetting. We concurrently carry out technical appraisal, registration, review and approval, and the system review and approval to maximize the efficiency of vetting. To serve the prevention control efforts in the emergency review and approval process, we collaborated with the National Health Commission, Ministry of Science and Technology. We also connected with the research institutes, intervened early, and guided their practices. We've organized a sectoral expert panels to answer questions on clinical uses. Up to now, we've reviewed and approved 30 diagnostics for COVID-19. The current working capacity has reached 9.02 million person times of use on a daily basis. The FDA authorities at all levels have been engaged in cross-sectoral and cutting efforts to facilitate and accelerate the registration of masks and other medical devices. Special vetting processes have been adopted. We have been carrying out a lot of efforts concurrently, and we have an emergency vetting process for some of the manufacturers that have been shifted to the manufacturing of medical devices so as to meet the need of prevention and control. I have some latest data to be shared here. As of 24th of April across the country, diagnostic registration certificates 30, 357 approved certificates for protective units, 205 for medical masks, and over 800 certificates for the manufacturers of medical masks, 72 certificates for respirator manufacturers, and 409 certificates issued and approved for the infrared temperature monitoring. So most of these have been reviewed and approved in our emergency vetting process. On top of a regional data inquiry, CFDA has also included diagnostics, protective units and gowns, infrared temperature monitoring, respirators. Altogether, 5 categories of medical device data information have been summarized and is dynamically updated on our website. Thank you. Thank you. Next question, please. Journalist from the 4th row on the left side. Thank you. China Market Supervision News. Starting from the early of February, SAMR has been collaborating with 7 other ministries and departments and engaged in a program to crack down on illegal manufacturing of masks. What has been the progress? I'd like to ask Inspector Li Yujia to take the question. Thank you for your question. This thematic program is still ongoing. Since its initiation, SAMR has been following the national central government's deployment, and we've been following the instructions from the Party Central Committee and organized the thematic program to ensure quality standards of the masks production. In the previous press conferences, I have briefed you on the progress back then, so I'd like to brief journalists about the latest progress. Based on the results from our random checks, starting from February the 4th, as AMR issued the policy notice, and we began to be engaged in random checks across the country. We've selected 226 key mask manufacturers in 19 provinces, and we had the double random approach in our checks. We checked 253 batches of products in these 226 manufacturers. 47 businesses' production of 51 batches of masks were substandard. We requested the manufacturers to conduct resolute and immediate correction efforts. Apart from correcting the wrong practices, they must forbid the substandards to masks to enter the market. 360,000 substandard masks were forbidden to enter the market. Such efforts are still ongoing. We will make an adjustment in accordance to the situation changes and change the targets and the subjects of our random checks and supervision. During the progress of these inspection efforts, we required market supervision authorities at all levels to keep unrelenting focus on the random checks. Up till now, we have sent 11 million person times as inspectors and checked 1,700 plus manufacturers and identified 89 million plus substandard masks. We've also found problematic prevention and control supplies, altogether numbered 470,000 items, and problematic disinfection supplies, and a total value of 7.9 million RMB. And the illegal practices engaged in the substandard manufacturing of masks altogether numbered 29,000 cases, with a total value of 300 million RMB, and 750 plus cases were transferred to public security agencies.
On the right, on the third row, the lady reporter, please. Thank you. With Southern Metropolis News, yesterday's 3 ministerial joint circular requested that the face masks should be subject to the importer and exporter's quality standard, and it is not required to have the NMPA's approval. Does that mean the requirement has been slackened, and will this affect the the masks to be exported? We will have DG Li to take the question. Thank you for your question. On March the 31st, the 3 ministries jointly issued the number 5 policy circular. It was about the 5 categories of medical supplies, including the face masks. For the export of such supplies, there must be approvals from the NMPA, which is reflected by the export product license or certificate. Compared with the number 5 circular, the number 12 circular emphasized in 2 aspects the quality for exported products. One is about the face masks for non-medical use. The specific regulatory measures can be summarized as 2 lists and 1 declaration. For exported face masks, which are not for medical purposes, they should satisfy either domestic or foreign quality requirements. So, for companies who are certified by the Ministry of Commerce, and also the Ministry of Commerce is providing the white list, while the SAMR is providing the black list. Also, the exporting party as well as the importing party should sign the joint declaration, making the commitment that the products, especially the face masks, can satisfy the local quality requirements and will not be used for medical purposes. Secondly, we are to further regulate the exporting order of the supplies for testing kits as well as other anti-epidemic supplies. The Ministry of Commerce has already entrusted the CCCPHIM to verify and to give the approval for export of such supplies. The relevant list will be found in the association's website, and it will be updated dynamically. As for previous contracts signed, in the number 12 policy circular, there are specifications or specific articles governing such contracts. Companies can choose to implement or execute the contracts as previously decided. However, in the export, there should be joint declaration submitted to the authorities in order to facilitate the smooth transition of the policy and the policy implementation. A few days ago, the Ministry of Commerce has already notified the relevant companies and authorities to make the transition, and also requesting the exporting companies to sign the joint declaration with the importing parties in order to avoid any potential obstacles in customs clearance. Right today, during the lunchtime, the Ministry of Commerce sent out a notice to the general public and requests the exporting companies to get to know the specific requirements, and this policy document can be found in the MOC website. We suggest the relevant companies to have a look into this policy document. Now we will allow only 2 questions due to the time constraint. Okay, on the left, on the 3rd row, the lady reporter, please. Thank you. With Xinmin Evening News, recently we noticed that many ministries have strengthened the regulation and inspection on exported products. How about the export of face masks? And also, in cracking down the illegal practices, what are the measures or efforts made by the GACC? We will have DG Jinghai to take the question. Thank you for your question. To further standardize the exporting of the anti-epidemic supplies is considered as a major contribution by China to facilitate the world pandemic response. According to the data we have, from March the 1st to April the 26th, altogether, the customs has already released 55 billion yuan worth of anti-epidemic supplies, including the face masks, 109 million protective gears, and the infrared thermometers, surgical gloves, and etc. The export of the anti-epidemic supplies in early April was about 1 billion daily, but recently this figure has been increased to more than 2.5 billion yuan. That means the export is on the remarkable rise. The Chinese customs authorities attach great importance to the export of such anti-epidemic supplies, and we have strengthened the regulation and inspection. Recently, we disclosed 2 groups of illegal and malpractices. They were mainly about underreporting and also the inferior quality of the supplies. So we would like to take the opportunity and remind the exporting companies to fulfill their responsibilities in clearing the customs, and we will crack down any illegal and malpractices in the export of the anti-epidemic supplies. We will take a firm approach to ensure the sound order of the export of such supplies. GACC is implementing the central government's arrangement, and we support the qualified and reputable companies to export their products, and we will try to create a favorable environment for such export, supporting the global pandemic response. Thank you. Last question. On the right, on the 5th row, the 3rd gentleman reporter, please. Thank you. With the Shenzhen TV. My question is, recently, China has worked out more stringent regulatory measures, and 2 companies were suspended due to their inferior quality. So what is the plan for the next step? We will have DG Li Xingqian to take the last question. Thank you for your question. The Chinese government has always attached importance to the quality of the anti-epidemic supplies exported. In at the critical stage of pandemic response, the quality of these supplies is of paramount importance. Following the State Council's overall arrangement and request recently, MOC, GACC, SAMR, and NMPA have jointly worked out a series of policy measures.
Production, manufacturing, circulation, distribution, and export were all the important links brought under supervision. Relevant departments and ministries have been engaged in coordinated law enforcement to crack down on the substandard, falsified, and counterfeited products export. The illegal practices, once identified, will be brought under justice, and the manufacturers related will be exposed. All these measures have generated great effects. In general, we have ensured the quality of manufacturing and exports, and we have won high acclaim by the international community and domestic buyers. In our research and survey, we have found that the inferior quality of anti-pandemic supplies were because of multiple reasons, and an important reason is because of the inconsistency in domestic and international quality standards, and also sometimes the non-medical masks exported from China were used for medical uses. To avoid the reoccurrence of similar problems, the number 12 order requires a joint declaration by the exporter and importer to confirm the bilateral acceptance of the quality of products. Importer will make a promise that the imported non-medical mask will not be used for medical purposes. Ministry of Commerce will collaborate with other departments and enforce the relevant supervision to ensure the quality of anti-pandemic supply export. We also hope other countries and regions in their importation of anti-pandemic products can conduct necessary quality supervision, and in the utilization of the imported products, countries are recommended to follow strictly the prescriptions and descriptions of the products. We also suggest that bilateral enterprises to enhance discussion follow the contracts. Thank you. I'd like to thank the guest speakers for taking questions on the quality management and supervision of anti-pandemic medical supplies export. Tomorrow we will focus on law-based prevention of imported cases. We will have officials from NHC, GACC, NIA, and CAAC to take questions from the journalists. We welcome your continuous attention to the press conference, and we conclude today's press conference. Thank you.